Again, my name is Carolyn Cass. I'm a health coach with First Mile Care. I'm a master's in public health and community health education, and I teach about 7 classes in the Woodlands, and happy to be here for you. Okay, here we go. So this is important in the aging process. Aging is a natural process in our lives. As we age, we experience gradual changes to our brains and our body. Totally normal. Your brain ages just like the rest of your body does. So it shrinks in size, it slows down in speed, it becomes less adapted to change. However, there's some great things that we can do to combat that, and that's what we're going to talk about today, and keeping our brain healthy. So most of us will experience no problems with memory as we get older. We will continue to have strong memories, and our ability to remember will not decline rapidly or substantially. So, and then, we can do certain things to help that as well. Some of us will experience memory loss. So there's about a stat out there that says about almost 40% of us will experience some form of memory loss after we turn 65 years old. But even if we experience some, type of memory loss, chances are you're still unlikely that you'll have dementia. Okay, so there is an age-associated memory impairment, and signs of memory loss as a part of a normal part of aging is you're unable to remember details of a conversation or event that took place about a year ago. You're unable to remember the name of an acquaintance. Sometimes you may have difficulty finding, a word. It's up the tip of your tongue. That's very common for all of us. You might forget things and events occasionally, but you may be worried about your memory and thinking you're slipping, but your friends and relatives are not. No one is noticing. So that's all very common, very typical age-associated memory impairment. And then dementia, and dementia is a little bit different. And so the World Health Organization actually estimates that as we turn 60 years old, 5 to 8% of us will live with dementia at some point in our lives till death. So that doesn't mean that at 60 years old, 5 to 8 are going to, but you're more likely. So, and that's just a common fact. And that's something when your memory loss is severe to the point where it's affecting your daily life and ability to stick to your normal routine. You're finding it difficult to learn new things. You're finding it difficult to complete tasks you're familiar with, and others close to you are also starting to notice changes in your abilities. So those are more like signs of dementia, so that you need to. And obviously, if anyone is having any of these, they need to, discuss it with their physician. Okay, so diabetes and Alzheimer's disease. Now, Alzheimer's disease is a form of dementia, and it's the most common one. And according to a study reported in Diabetes Care, people with diabetes were 60% more likely to develop any dementia than people without diabetes. So this stat is important because as we're doing the DPP program, as you all participants, you're making amazing changes in your diet and exercise and your lifestyle to prevent type 2 diabetes. And so that's really important, but it's also important because having diabetes puts us at an increased risk for Alzheimer's disease. So that's kind of the link there. Okay, so our goal is to maintain and enhance. And there's so many things that we can do in order to maintain our brain health as we get older. So number 1 on my list is exercise. So exercise has great benefits on our brain health. Aerobic activity. So in our program, we strive to get that 150 minutes at least a week of moderate physical activity. So aerobic activity increases the size of our anterior hippocampus, and that's more the memory center of the brain. And so it leads to improvements in spatial memory, and exercise improves our blood flow and circulation in our body, and that results in great mood and a healthier mind. So it's very important. Exercise is really, really important. Now, and I know many of the coaches have probably talked, and all of my participants know this because I've told you about this, about the 4 types of exercise that we really want to strive for. So the first one is that aerobic exercise, okay? And And then the next one would be that we want to do the strength training. And that would be about at least twice a week, we want to do strength training. And that's going to increase our blood flow, increase our mood, and it's going to be great for our balance. And then the third one is balance. So we want to do balance exercises to prevent falls. And the fourth one is flexibility. We want to become flexible to prevent injuries. And it's great for us to breathe and to stretch and be flexible. Those are the 4 types of exercises. All righty. So the next thing that can help us with our brain health is our diet and eating healthy. Foods rich in antioxidants can help fend off harmful effects of oxidation in our brain. So there's been studies that actually linking diets and refined sugar is harmful to the brain because our body can't regulate those blood sugar levels. So which promote inflammation and worsens the symptoms of depression. So we talk about food and mood and our comfort foods and that vicious cycle that leads us our blood sugar levels spiking and then going and dipping down then, and that's not good for us. So nuts, fish, red wine even have been linked to healthy brains. And there's dark chocolates and all those different things. There's actually with probiotics, there is a study out there that says 25 to 35% lower risk of depression if you have a diet with probiotics in it. So it's really important. In our program, the DPP program, we, the program, I believe it's session 4 that we talk about what our plate should look like. And we talk about half our plate coming from the non-starchy vegetables. And we talk about getting protein in our diet, all those things. That's important for brain health as well. A lot of the research in brain health and diet has been geared towards the Mediterranean diet. So if you want to research that, and one of our coaches, Coach Kathy, actually had a webinar, I believe it was last week, on diets, and she did an amazing job. And so that's a definitely resource that you can look to your coaches for more information about it. But if you want to look into the Mediterranean diet, that's the diet that's most likely what our diet that we teach, how we want to eat. It's not really a diet, but it's more of what our plate looks like, that visual that session 4 gives you. All righty. So moving on then, the next one is social connections. Now, staying connected is so important. And the problem here, though, is with COVID, it's been an issue. And we've lost some of our extension with our families and friends and, outings that we've done, going, working out or going to the Y, social clubs, book clubs, whatnot. So a rich social network provides sources of support, connection. It reduces stress, it combats depression, and it just overall enhances our intellectual stimulation. So you get stimulated from other people. So studies have shown that those with the most social interactions have the least likelihood to the slower kind of rate of mental decline. So social connections. So what you can do, volunteering, if you're working, or if you're retired, you can go back to, some contractual work or social clubs. But overall, loneliness can result in the cognitive decline. So we want to keep up those social connections. Now with my groups, what I've been trying to help them when we talk about a healthy balance, we really want to have those social connections and support, whether it's FaceTiming people, writing them a letter, emailing them, reaching out, whatever you can do, have a Zoom party with your family, or if you find, ways that you can safely see them outside, outdoors, or socially distanced, so you have those social connections. So those are all great for brain health. And there's been research and studies, with nursing homes, and they decline rapidly because they are lonely and they don't have as much those connections when they were there living independently. So that's kind of what we want to talk about today, is preventing. We want to live a quality and a long life as independently as possible for as long as possible. And so these are why we're in this program. We're trying to make changes. We're trying to do great things to have that long lifestyle, improve our overall health, and add quality years to our life. Alrighty, moving on, reading. So I know that regular reading reduces the rate of memory decline almost by 32%, if you can believe that. So whether it's a book club or, you're just reading to your grandchildren, you can do it over the internet or FaceTime, subscribing to magazines or newspapers, reading online. Content. There's so much out there, but reading is important. So I have, again, I have my master's degree in public health. So I like the epidemiology aspect. So with COVID, I have been tracking and charting and doing different things in Montgomery County, and I'm doing so much. So I enjoy that research. So I am in a book club, but I do like to do research. So I kind of put that in that, realm, is doing some research and reading up on articles and looking at stats and crunching numbers and whatnot. So, but you can also think about it too if you are writing letters, or you can do an email, writing out cards, telling stories, poetry. All those different things can help. And so reading and writing are really important. Alrighty, now I'm going to sleep and stress management. So not only is it the amount of sleep that we need, and for those, it's usually, I think the stat is between 24 and 64 is about 7 to 9 hours of sleep, and 65 years old and older are 7 to 8 hours of sleep. So we want the amount of sleep, we want it to be consistent, but we also want to make sure that a critical component of brain health is the amount of oxygen delivered to the brain. So if you're not getting enough oxygen while you're sleeping, perhaps because of a health condition like sleep apnea, that can really affect things. So you really want to make sure that you get all of those sleep issues alleviated, because that will actually help your brain health. So, and also there has been studies and research that says that there's a buildup of a protein that is actually been linked to Alzheimer's disease during sleep. And the brain during sleep actually filters it out. So that's why we need the amount of sleep and the quality to be so important. All righty. And then moving on from there, stress management. So if everyone's had a session on stress, one of the sessions that we teach, we talked about progressive muscle relaxation, about meditation, being mindful, whether it's prayer, whatever it is, a gratitude journal. It's an important concept too for brain health. So just breathing and sitting quietly, practicing mindfulness can actually increase the gray matter density in our hippocampus. And so that's really, really important. So it's all been connected. Alrighty. So now the next three are art, music, and animal therapy. So with that, I want to make sure, I worked at a hospital for about 4 years, and we had an amazing art, music, and animal therapy department in the hospital, because there's been so much research that ties these arts and the music and animals with health benefits and better outcomes in the hospital setting. So there is an increasing amount of evidence that actually proves art enhances our brain function. It has an impact on our brain waves and emotions and the nervous system. It's all connected, and it actually can rise our serotonin levels, and art can change a person's outlook and the way they kind of experience the world. So it's amazing. So if you appreciate art, that's something that will help your brain as well. Music, in addition, listening to music can be relaxing, but also be linked to improved memory function. And then animal therapy. Simply petting an animal can decrease the level of stress hormone cortisol and boost the release of the neurotransmitter serotonin. So it results in lower blood pressure and heart rate, and it just puts us in a better mood. So pets can bring calm as well as companionship. And, that's along with those social connections that we talked about a little bit earlier too. So they are our companions, and it can be someone's best friend. So, and then the last one I have here is learning something new. So that's really important, whether it's a craft, a skill, a new language, all those things, and just openness to new experiences, as well as the curiosity and being a lifelong learner. All those have been proven to have really an effect on our brain health. And so you can train an old dog new tricks. And so you can learn new things. So if you want to, I encourage you right now, just kind of think about old hobbies and hobbies that you would like to try, or different things, other interests that you may have, whether it's knitting, sewing, gardening, cooking, photography, astronomy, golfing, fishing, anything that you, for me, personal example would be, I like to take like all my old furniture and I like to like chalk paint it and put on new knobs, and that just kind of relaxes me. So in addition to exercise, that's something that I like to do. So just find something that you really want to do and learn something new, because it's really, it's amazing. It has amazing benefits for your brain. Okay, so the last part is train your brain. So there's so many things that you can do to help. So there's puzzles, solitaire, word, number games, brain teasers, matching games, video, computer games, so many things out there to train your brain for. So even adult coloring books that are out there, drawing. It's excellent way to sharpen your brain and stimulate your mind. They require concentration, memory, problem solving, and can help, really help your brain. So, video and computer games like Tetris. There's going to be solitaire. You can do apps. You can do games online. There's a plethora of things out there. So I encourage you, or you can just do it old, your card deck and get that out and play yourself. So there's many things out there. One thing I wanted to do was just a quick brain teaser challenge for you. So this brain teaser is name 2 objects for every letter in your first name and work up to 5 objects if you can. So if I'm starting just with 2 for me, for Karalyn, kite would be an object, a kitten, for apple, antenna. So I'd encourage you to do that right now. Just kind of jot it down and think what you can. Those little things, there's on YouTube, there's brain teasers and challenges and things. Can you notice this? All of those things get us thinking, get us using different parts of our brain and our memory and our concentration, problem solving skills, and all that. So you have to, use it so you don't lose it type of mantra there. So that's important to know. And I also have some resources. So you'll be getting a copy of all these slides emailed to you, as well as a survey, post webinar survey. So our healthybrains.org is from the Cleveland Clinic. Luminosity is one, Sharp Brains. Some of them are some paid subscriptions, and some of them have some free content. But even if you just, Googled or did on YouTube, there are definitely so many resources out there, and really cool different brain teasers and games out there that are adults, minded, that would be great to play. So let's see here. So overall, by maintaining brain health and making smarter lifestyle choices, what we're talking about in our DPP program, you can improve your overall health and add those quality years to your life. So it's really, really important to keep your brain sharp.